Welcome to our video today. I'm Lori Smith and this is my friend Heather, and we are going to explain sterile technique to you, how to set up a sterile field, and how to doff and don sterile gloves. Heather has a very important job here.
Yes, my role is to make sure that Lori does not make any mistakes in maintaining sterile technique, and if I see her doing that, I will bring it to her attention.
And that's really important because if you break a sterile field or contaminate it, you have to start over. It's not the end of the world, but you have to start over, or you're not practicing with integrity. And we want to make sure that we care for our patients the best we can. So this sterile technique is really important. We're going to use it a lot of different times. In your clinical settings, you'll see it when you repair a laceration, when you insert a Foley catheter, if you help with the central line insertion or a porta access. Those are all really common times that a sterile field is set up. So I'm going to go ahead and show you what we would do. First, I would either wash my hands for 30 seconds or I would use some hand sanitizer, which I have right here. I'm going to let Heather use it too because it's just fun to do it together.
That's right.
And I've got a Foley catheter kit, a partial kit here, just because I want to show you how to set up this sterile field. So my hands are clean, they're not sterile. So I'm going to open my kit and pull out my box. I'll put this in my garbage can. And when you open a sterile field, you never want to reach directly across it when it's open, because if you reach across it, you're contaminating it. So as things are folded, as they're prepared, they're folded to open them the correct way. So I'm going to open away from me. And I'll open all four corners away from me, except this one comes toward me. And as you can see, it never opens perfectly. You're going to have things flopping around. It just happens. When you dump your materials onto your sterile field, it'll help flatten it out. I knew that the dogs would do this. They're knocking at the door. So what I'm going to do is I'm going to take, there's usually a set of sterile gloves on top of the kit. I'm going to take them out of the kit and set them right here so that you can see them. As long as I'm touching the outside of the packet, the gloves are still sterile inside. Mm-hmm. And then all of my other materials that I need that are in the box, I am just going to simply dump them into the center of my tray. And I'll toss this in the garbage. So everything on that blue cloth right now is sterile. Mm-hmm. So I'm going to go ahead and clean my hands one more time, and then I'm going to put on my sterile gloves. I'm sure that you can hear my dog, right? She's whining at the door. So I'm cleaning my hands, and you want to be patient and let this get dry, because if you try to put on sterile gloves with wet hands, you're going to end up having 3 fingers stuck through one thumb hole, and Exactly. It's not going to work.
Exactly.
Heather laughs because
Yes.
she's done it.
I've been there.
Yeah. So you open your sterile glove packet away from you, and then it's got 2 flaps that you lift right here. You lift them, and then you open it outward. Now my gloves are upside down, so I'm just going to simply turn my packet. When you're putting on your gloves, that you'll realize that they're cuffed as they come out of the package. There's a cuff on it, and you can reach inside. Well, actually, I'm going to pick it up this way. I'm touching what'll be next to my arm, and I'll slide one hand into the glove.
Only touching the cuff.
But right, I'm only touching the cuff. And then on the next glove, I reach inside the cuff and I slide my hand in. At this point, my hands are sterile, so I can grab this one that didn't fold down and pull it down.
Right.
So now my hands are both sterile. Right. At this point, I keep them above my waist. Right. Because they're sterile. I'm going to let Heather throw away this paper for me just to get it out of the way. And I'm going to say, Heather, can you put that cup for a specimen on my sterile field?
Sure, be glad to. I'm just going to read hand sanitize just in case I have touched anything, so that we ensure that what I do touch and dump out is clean.
Sterile.
Sterile. Yes, sorry, sterile.
Yep, it's okay. And that's why you work with a partner, because you want to make sure what you do is correct. So
what I want to not do is touch the contents of this bag without them. I just want them to open the bag enough to where I can get the contents out without touching them right onto the sterile field, so they're not contaminated. And there
good.
You go.
And she could do the same with this other packet. This is an IV pack.
So if this weren't open, of course I would just peel it open. I like to hold it like this, and then I gently just hold it open, pull it all the way back, and then just gently, so things don't go flying everywhere, just place it onto the sterile field.
So now we've got a pile of stuff in our sterile field. This is where I can take my sterile hands and I can rearrange things. And that can help open this paper. Can you grab a little bit of water in a cup and pour some in this cup? Yeah, just go ahead. So if you ever need to add liquid to a sterile field, you come in from the side and you pour it in the cup.
Without touching either part.
Yeah, you don't touch anything on the sterile field.
Can they see? Is that up for you? Okay.
And you get it right in the cup, and you try not to spill.
Right.
Beautiful.
And that's it.
That's all you do. So then whoever's going to be using the sterile field can work with it. There is a 1-inch border all the way around that is not sterile. So if you can just imagine, 1 inch around the perimeter of the sterile field is not sterile. And if I'm talking right over my sterile field, I'm contaminating it. Right. But anything that is on here is sterile, and these things can touch each other, but they cannot touch anything that's not sterile or off the mat.
Right. I can't go grab it in there and go, ooh, I would like that tourniquet.
Right, because if you touch somebody's sterile field and mess it up, they'll be mad. And
Right.
you'll have to go get a new kit, and they'll have to start over.
Right.
Okay, so the principles of asepsis that we have demonstrated and want to reiterate are: sterile objects remain sterile only when they're touched by other sterile objects. If anything else touches them, they're only clean. You lose your sterile field. Only sterile objects can be placed on a sterile field. Nothing that's clean could be placed on here. If we put the hand sanitizer on here, it's not sterile anymore. If you can't see something or it's below your waist, my sterile field is contaminated. Here's an example.
Uh-oh, Lori, you've turned your back on our sterile field. I could have touched something in there.
Dang, we would have to start over.
We would. And I would not be happy.
So you don't turn your back on your sterile field, because
Right.
if it's out of view, it's contaminated.
Right.
Or if you can't remember something,
as in Lori
or your hands go below your waist,
Right.
you're contaminated.
Right.
So that's another principle of asepsis. So sterile objects can only touch sterile objects. Sterile objects can only be placed on a sterile field. If you can't see it or it's below your waist, it's contaminated. Prolonged exposure to air, and they're talking an hour probably, a long time that a sterile field just sits open, that can contaminate it. Also, wet objects. If I knocked this water over, my field is contaminated. So wetness contaminates a sterile field by capillary action. So you have to be careful when you're adding liquids, betadine, water, whatever it might be, to a sterile field. And then the last principle is that 1-inch border that I told you about. 1 inch around your sterile field is dirty, or, well, it's clean. So when you're setting up your sterile field, you only open it from the corners or from the very edges, because that's a 1-inch clean border, but it's not sterile. So if this were sterile, but it rolled to right here on the very, very edge, it's now contaminated. So I would send my buddy to go and get another one.
Right.
So that's a reason why it's important to have a buddy. And sterile technique can be fun, and working together with teamwork with nursing is the way to do it. So I hope you've enjoyed our sterile technique demonstration. I hope that you have learned those 6 principles. We'll review them again if you're in our 380 Skills Lab, and have fun. Thank you.
Thank you.